Welcome to This Explainer. Today, we're putting on a completely new pair of glasses to examine how modern psychology treats two really crucial populations, women and older adults. And hey, if your goal is to truly learn this in depth and actually remember these concepts long after we're done, well, you are absolutely in the right place. We're going to break the whole thing down step by step.
But right before we jump in, consider this for a second. Historically, psychological theories were heavily male-centered and very youth-oriented. Think about it. The default human in early textbooks was essentially a young, white male. So that approach created a massive blind spot, which really leaves us to wonder, how do we effectively treat everyone else who doesn't fit into that super narrow mold? And how did the field finally adjust?
So here is our roadmap for today to help build that mental framework. 1. The multicultural counseling shift. 2. Women, context over pathology. 3. Women, trauma and empowerment. 4. Older adults, challenging ageism. 5. Older adults, strengths and meaning. And finally, 6. Parallel struggles, shared empowerment.
Okay, Section 1. The multicultural counseling shift, moving beyond the social vacuum.
So, traditional psychology had this really stubborn habit of isolating the individual. If you were anxious, the old approach basically just asked, well, what's broken inside your brain, right? Pure individual pathology. But the multicultural approach realizes that psychological difficulties don't just pop up in a social vacuum. If someone is dealing with systemic poverty or workplace discrimination, their anxiety is actually a completely normal reaction to a very abnormal environment. It's not some internal defect. We absolutely have to look at the broader social, cultural, and political context if we actually want to help people.
Moving right along, Section 2. Women, context over pathology, looking at the system.
Let's practice putting on those new glasses and applying this contextual lens, starting with women. Look, if you remember only one single thing from this entire section, make it this cognitive shift. We are moving entirely away from blaming the individual, asking, what is wrong with this woman? And instead, we're examining the system, asking, what social conditions contribute to her distress? It's a game changer. It completely flips the trajectory of therapy from fixing a supposedly broken patient to validating their actual lived reality.
To really understand those social conditions, we have to look at role strain. Just imagine the exhausting reality of an average Tuesday. A woman might simultaneously be acting as a full-time employee, a mother to a toddler, a supportive spouse, a caregiver to an aging parent, and the primary household manager, the whole shebang. Multicultural perspectives argue that the higher rates of depression we see in women aren't just biological. They are the direct result of the cumulative, chronic stress of juggling these literally impossible societal expectations. And beyond those daily roles, we have to look at the deeply ingrained socialization messages women receive right from childhood. We're talking about things like submissiveness, dependency, and this expectation of relentless self-sacrifice. Now, while maintaining relationships is obviously a wonderful thing, society often weaponizes these traits. When a woman prioritizes her family to the point of completely neglecting her own physical or mental health, tremendous guilt, burnout, and frustration start to emerge. That conflict between societal expectation and basic personal survival is profound.
All right, Section 3. Women, trauma and empowerment, shifting the paradigm.
Let's move to a really critical area where this multicultural lens literally saves lives, and that's domestic violence and trauma. An uninformed traditional counselor looking at a domestic violence situation might just ask, well, why doesn't she just leave? And frankly, that is a terrible therapeutic error that inherently blames the victim. But a culturally competent counselor asks a radically different, empowering question. What psychological, economic, cultural, and safety barriers make leaving difficult? They get that if a survivor lacks access to a bank account, or if leaving triggers an immediate escalation in physical danger, staying is actually a highly complex survival strategy, not a sign of weakness.
This non-judgmental shift leads us directly to the ultimate goal, which is empowerment. Traditional models focus way too heavily on just reducing a client's symptoms, just lowering their heart rate. But here, the goal is facilitating true autonomy. A counselor actively helps a client develop self-efficacy, increases their capacity to make independent decisions, challenges those oppressive beliefs they've internalized, highlights their hidden strengths, and finally, helps them establish ironclad, healthy boundaries. It's about giving them true control over their life.
Section 4. Older adults, challenging ageism, breaking down stereotypes.
Now let's take that same multicultural lens and apply it to our second population today. Just as we shifted away from individual pathology for women, we absolutely have to do the same thing here. The single biggest roadblock to effective counseling for older adults is ageism. That's the prejudice, discrimination, or negative assumptions directed toward older adults. The belief that aging inevitably and automatically equals psychological decline is the most harmful misconception in gerontological counseling. Aging itself is not a disease, but societal prejudice, it often treats it like one.
Think about it. If a counselor walks into a session holding unconscious assumptions, believing the older client is entirely inflexible, totally resistant to change, or just fundamentally incapable of growth, they are seriously compromising the treatment. The counselor will unconsciously lower their expectations, they'll talk down to the client, and they'll withhold the dynamic, challenging therapy the client actually deserves and intensely needs.
So, instead of lazily blaming old age for a client's distress, a culturally competent counselor looks at the context, specifically what we call cascading life transitions. Imagine retiring from a 40-year career, losing a spouse, and experiencing a sharp decline in physical mobility, all within an 18-month window. This sheer accumulation of repeated, rapid loss creates massive adjustment demands. The resulting grief and depression are a totally natural human reaction to loss, but tragically, it's often misdiagnosed as just normal aging. Sadness is for sure not an inevitable symptom of getting older.
We also have to apply this contextual lens to cognitive assessments. Normal cognitive aging might look like a slightly slower processing speed or just minor forgetfulness, like misplacing your keys. That is entirely different from a neurocognitive disorder like dementia, which requires specialized intensive intervention. Failing to distinguish between those two can result in highly inappropriate treatments, widespread family panic, or even wrongfully stripping an older adult of their independence. Context is everything. Moving on to Section 5, Older Adults, Strengths and Meaning, Fostering Resilience.
Let's flip the script from vulnerabilities to the incredible assets this population holds. Modern, multicultural perspectives flatly reject the old medical deficit model, which only looks at what older adults have lost. Instead, we focus on a phenomenal arsenal of strengths, decades of wisdom, highly developed emotional regulation, and deep, battle-tested resilience. Research clearly demonstrates that older adults rely on these accumulated coping skills to maintain remarkably high levels of happiness and well-being, even when facing really substantial physical or life challenges.
A huge part of utilizing those strengths is resolving what the psychologist Erik Erikson called the central conflict of late adulthood, ego integrity versus despair. At this stage of life, people naturally look backward. Counselors must actively help clients navigate toward integrity, helping them weave together their memories, make peace with their choices, and view their unique life story as meaningful and worthwhile. Because if we fail to help them find that meaning, they risk slipping into the dark waters of regret, bitterness, and despair.
And finally, Section 6, Parallel Struggles, Shared Empowerment, Synthesizing the Lens.
This brings us to a really brilliant synthesis of everything we've explored today. If you want to deeply remember the core of multicultural counseling, this is the takeaway right here. While the primary marginalization differs drastically between these two groups, with women battling sexism and rigid gender roles, while older adults battle ageism and over-medicalization, the multicultural antidote is remarkably identical. For both populations, modern counseling requires shifting away from blaming the individual and moving aggressively toward empowerment, validating their specific struggles, and offering deep, strengths-based respect.
But we do have to remember one final, vital nuance, and that's intersectionality. Neither women nor older adults are a single copy-and-paste monolithic group. A 75-year-old wealthy white man experiences aging very differently than a 75-year-old immigrant woman living in poverty. These identities overlap with ethnicity, economics, physical ability, and religion, creating entirely unique experiences of discrimination or privilege. Because multiple identities operate simultaneously, our interventions can literally never be one-size-fits-all.
We've covered a ton of ground today, breaking down how systemic, societal forces shape what we used to mistakenly label as just individual distress. So, now that you've put on these new glasses and you understand the profound power of context over pathology, I'm going to leave you with this to chew on. How will you use this new contextual lens to examine your own biases today? Look around your workplace, your family, your community. Where else might this lens completely change your perspective on the people around you?